just this afternoon, the department was notified by our Bureau of Laboratories that we have our first positive case of novel coronavirus.
We're trying to flatten out this curve by slowing the spread of coronavirus.
In response to multiple confirmed cases in the county and the state, together with cities in the Treasure Valley, so Ada and Canyon County, as well as county governments, each of us declared a state of emergency today.
Today, I will be issuing a statewide stay-home order for all of Idaho.
I think we were all in shock about how this was gonna really spread like wildfire. And it was so hard for us because you'd see people who would be just a little sick from having COVID, and then we had those really tough cases that we might be the last people they talk to before they get intubated, and we were their line of communication with their family members.
I just remember when it first happened how isolated everybody was, and how when you did go out, there was no one around, and it just felt so foreign to me.
It's super real. It's very real. It's very hard to deal with, especially if you have a family member that happens to get sick. Even though I work in the healthcare, I see it every day. When I myself got COVID, my wife as well, we immediately went, what does this mean for us? What's going to happen? What's day 2, day 3? Am I going to have trouble breathing?
There's been a lot of devastation, and it's hard to forget. As a nurse, I felt pretty helpless, like I couldn't help these patients or do enough to save them. I think I'll remember just the air hunger, the lack of family being present, no support, their anxiety, the fear. It's nice, typically in the intensive care unit, when patients are that sick, they're able to have a lot of support from their family, which makes a huge difference, just having someone there. And these patients have been entirely alone, and I think that's one of the things I'll remember most.
I personally remember one of the first COVID patients that I took care of. She was having a really hard time with depression, being in the hospital. She couldn't visit her family. She didn't have FaceTime on her phone or anything like that. She said she was really lonely, and I had all of my PPE on, and I gave her a hug, and she started crying and wouldn't let go of me. And that was probably the biggest moment where I was like, wow, just something small like human touch was something that these patients were lacking.
I wish there was more positive things I would remember, but unfortunately there's not a lot of positivity. I feel like I didn't get to see very many people walk out of the ICU.
If you love freedom today, why don't you raise those signs high and shout freedom? Shout freedom!
Yeah, it's infuriating. I mean, especially these patients that come in here that have had a lot of devastation or have lost a family member, and then you see these people burning masks. I can imagine how they feel.
We were all working crazy amounts of hours. We were all each other's support system. We could only know what each other was going through because we were all in it together. It's hard when you have family members that think they have an idea of what's going on in the hospital, but until they are really like knee deep in it, you can't say that you've been there. We relied on each other a lot for grieving, for moments of laughter, just to get through a work day. Even little things like, did you drink some water? Here's some food. Like, you know, little things just to try and keep each other's spirits up.
I'm optimistic for the future. I'm hoping the vaccines are starting to work. I'm still a little bit skeptical because we've had times in which we've seen a decline in patients and then a drastic increase all of a sudden.
Will there be another wave? If it is, one of the things they talked about at that grief session was the actual amount of deaths, which I hadn't heard an actual tally or a number for a month, and I was completely caught off guard that there was actually that many in a month, or especially those early months. And
the vaccine has given us a lot of hope. Our numbers in Idaho are much, much better than they were a few months ago. And that, for me personally, I feel like it's a chance for us to take a breath finally. You know, we were going at full speed, 110% of our energy for so long. Now we're starting to see maybe there is light at the end of the tunnel. We're not there yet, and I don't want people to start relaxing and not doing the things they know they're supposed to be doing right now. I want to continue seeing the good improvement that we've made so that we don't go back to where we were.